how the SICAT Rapid Digital Guide workflow was a game changer for Dr. Scott Grant in 2023. Find out in this exclusive SICAT podcast snippet.
How do you think SICAT, with the software and then the Rapid Digital Guide, and you mentioned, in 2023, you basically doubled your number of implants. I mean, obviously the return on investment from that has got to be pretty significant. And do you attribute most of that to the workflow then?
I really do. I sincerely do, because we haven't changed anything in our marketing except for the way we feel about it. And I'm so confident because it's so accurate and it's so simple. And my team is confident because it's accurate and it's simple. And from a workflow standpoint, when somebody says they want an implant, I literally, after I just did the presentation I talked to you about, I leave the room. The team finishes everything they need to finish. They have fun sort of saying, well, hey, this is kind of where I think the implant might be. I come in here in between patients and I said, yep, I make my tweaks, I adjust it. That's exactly where I want the implant. I leave, and about an hour later, I'm holding that same stent, finished. I mean, yesterday, start to finish, mid-surgery, I was finished in 45 minutes with that whole process, starting from zero to implant to the stent in my hand was 45 minutes, and the surgery was done in 60 from that point.
Oh, good. So from a patient experience, they're seeing fewer visits and shorter visits and less invasive procedures?
Yeah. When we have, even to extend that, if we end up using like a healing collar versus a cover screw, we'll save the guide. They come back in the time they need to, whether that's 30, 90 days later, and we put the thing on, we tissue punch right through it. We didn't have to guess. We didn't have to mess with it. And it's 100% seamless. So their pain is reduced incredibly by simply using the guide during surgery and for finding the osteotomy to do tissue punch later. So they're happy. Patients are super happy.
Well, that's thrilling. Yeah. I bet they get a lot. Do you get a lot of word of mouth from patients because of that, because of the technology and basically the outcome that you get?
Yeah, there's no question. And I'll tell you, the number one thing that happens is the person, when I do all my case presentations, I insist that the spouse or loved one is there. I like people to hear. I like them to both hear it. They're both decisions makers with their finances. So I like them to be there to have both questions answered. And oftentimes the person that comes in is the other one who says, you know what? I'm next after that. That's happened more times than I can count. And they end up going, if that's all it is, I'm in. I've kind of been thinking about it myself, so.
Oh, yeah. Yeah. It takes away a little bit of the fear of having something done, a procedure like that.
Would you like to find out more about Dr. Grant's successes with the SICAT Rapid Digital Guide? Then check back here regularly so you don't miss the next podcast snippets.